So we're going to talk about nipple shields. So nipple shields are a little silicone piece like this that helps to elongate mom's nipple and gives a little bit of firmness that sometimes can help babies latch. Now, these are not a fix for everything. I recommend using these sparingly. Most babies can latch perfectly fine without it. You just have to figure out what works for them. But there are reasons why you might use this. Most commonly, when mom's nipples are either flat or inverted, or if babies have gotten a lot of artificial nipples like pacifiers or bottles early on, maybe due to the NICU stay or maybe mom's choice, but some babies struggle going back and forth between the harder, firmer bottle nipple and then the squishier breast tissue nipple. So they have their place, but like I said, use them sparingly and only after every other intervention has been attempted. So making sure babies are up and ready to eat, making sure that mom's nipples are nice and like everted and firm. So that might mean that you need to do some hand expression or hand pump and teach mom how to do that to right before latching to help bring out that nipple and kind of bring down the colostrum to help entice baby. Sometimes you can try to express colostrum or drip it on the nipple to get baby enticed to kind of latch to the nipple without the shield. But if you've tried all the tips and tricks and nothing seems to be working, especially if babies are on chem strips that we're watching or really struggling, have not really been able to eat, then yes, absolutely use it as a last resort type of situation. Um, so, a couple things with the nipple shield. You want to make sure that it's the right size for mom. So, to do that, you're going to measure mom's nipple. So, we'll take our little breast model here, and we're going to measure mom's nipple to the best fit. So, for her, she's about a 15. So, then we know the 20 is going to fit fine. Might be a little bit big, but these, again, kind of conform to the tissue. So the way you put it on is not like a little sombrero. Okay, you can, but sometimes it doesn't stay very well. So what might work better is if you kind of fold it in on itself a little bit and then come up and over so it pulls that nipple in and kind of flattening it out. So I'll do that one more time so you can see. We're going to kind of pull that shield in on itself, aim the nipple up and over, and then pull it on over. So you want to center it in the shield. You don't want it to be too more to one side or the other. You don't want it to pinch or hurt mom. So and babies still can if they're not latched well, but you want to make sure that the shield's not the problem first. The same principles of latching apply with or without the shield. So baby still has to come chin first, kind of nose to nipple, up and over chin first. Nice wide mouth to the tissue. No little pinchy fishy lips here in the corner. We want nice wide lips. And no slipping and sliding of the shield in the mouth. If you see that they're not engaged enough, there's going to be air and it's not going to be a good seal. So the other thing with the nipple shields are, and the reason why they can be a little bit cumbersome, other than they like to fly around when babies' arms are going everywhere, is that they can reduce the stimulation kind of between the nipple and the baby and the nipple, kind of creating a barrier. So it can kind of reduce that stimulation, which may affect milk supply. These new shields are pretty thin, so they may not affect it as much as they used to in the past. However, especially if mom is early on, maybe baby was born early, maybe it's her first time, anything that might delay her milk supply anyway, you may want to have her pump afterwards. So I recommend setting mom up to pump, explaining to her that this will help her milk supply just for 10 minutes, just for stimulation. She might not get anything out, especially in those early days of colostrum, and that's okay. It's just to help kind of get things going so that if that is dampening signals or if baby's not latching the best, we're not getting too far behind on the lactation, like the lactogenesis to get the milk coming in. And then once your milk supply is in, if it's pretty robust, you may not have to pump every time. But I would still recommend pumping at least a few times or every couple times or so, just to help keep the milk moving. So if there's any questions on how to use the shield or when to use the shield, or if you should use the shield, you can always ask us, and we're happy to go over it with you, or ask someone who may have more experience if we're not available. You can also make sure to let mom know to contact us, especially if she's going to be discharged that day or something, so that we can work with weaning off the shield. Some babies will come off easily as soon as like the milk comes in and they get going and then off they go. And other babies take a little bit longer, and there are a few that might not ever be able to do it without it, just due to the anatomy or baby's preference. So the sooner we know and we can work with them, then the better we can figure that out with mom, and make sure that it's an easy transition for them. So just let us know if you have any questions.